Can you guys see my screen?
Not yet. Okay, I see.
Perfect. All right,
Yep.
everyone can see it? Perfect. So, like I said, today we're going to be going into the topic of creating a peer support culture. Now, why is this important? Um, because working in a hospital setting, we encounter a lot of different things on a daily basis that can significantly affect us, right? According to Dr. Jeffrey Mitchell, he says a critical incident is any situation faced by any person that causes them to experience unusually strong reactions which have the potential to interfere with their lives. You can also think of this as a trauma, right? Something that occurs to you that shifts the way you see things, shifts the way you respond or react to things. And, obviously, working in a hospital setting, regardless of the position you hold, um, you're exposed to a lot of things that not everyone is usually exposed to, right? Whether it's directly to yourself or just vicariously through the patients that you're treating, through the staff that you work with, through the people that you interact with on a daily basis. Um, and I think it's quite normal for professionals in our field to just kind of grow to normalize a lot of these things, to almost become desensitized to them. But the more and more you encounter them, um, eventually it's going to have some type of effect, right? And the key to this is that we can support each other, right? One of the things about peer support is that no one's going to understand your position better than someone who does the work that you do, right? So you know the ins and outs of you and your colleagues' day to day life, right? The things that you usually see. Um, so it can go a very long way to just create a peer support culture and be supportive of each other before reaching some type of point where you need to go reach professional help, right? And that's not to discourage anyone from seeking professional help. Sometimes we don't want to speak to the people who we do have access to, right? A lot of us have family members, colleagues, um, friends that we know we can count on, that we know will be there for them. But for one reason or another, we're just maybe we're not ready to open up and be vulnerable with them. And that's okay to seek help from anyone. But I do think having a meaningful presence and just offering that support to each other, to your colleagues, to your coworkers, can go a very long way. Here are some signs and symptoms to indicate that you might be experiencing some critical incident stress, right? Which I would say this is like on a very, very mild spectrum of post traumatic stress disorder, right? You're exposed to traumas, and now, whenever you're in a similar setting or something reminds you of that said trauma or critical incident, it can start creating stress. It can start creating anxiety, right? So, here's some of the signs or symptoms that you may be experiencing this type of stress. High levels of anxiety, right? And what is anxiety? Anxiety is worrying about future events that haven't happened yet, right? Um, you might become a little bit more irritable. You might be experiencing headaches, nausea or vomiting, difficulty concentrating, indecisiveness, might be having trouble sleeping, um, increased absenteeism, poor appetite, confused thinking, might be experiencing depression, remembering things about the past that make you feel sad, excessive sweating, anger, poor communication skills, feeling apathy, might feel overwhelmed, um, difficulty with calculating things, guilt, feeling of isolation, increased alcohol or substance abuse, and you might experience flashbacks to that traumatic event or to that critical incident, right? And again, there's different levels to this and different severities to this. But if you start experiencing any type of these signs or symptoms, that's just your body and your mind communicating with you that, hey, you know, you might want to discuss this with someone. You might want to address this. I like to say that we're like a kettle pot, right? And we can keep on adding things into that, but eventually that pressure is going to build up. All we have to do is press that pressure release valve, right? We have to get this stress out of our body one way or another, whether that's through physical exercise, whether that's through talking to a friend, through a colleague, to a professional. Sometimes you could just journal your thoughts, right? The point is that you're exiting the stress out of your body in one way or another. So some examples where we can experience these critical incidents. Like I said, we work in a hospital setting. We're exposed to critical incidents more than most people, right? And again, coming day in and day out to this setting, we can grow to normalize this and almost become desensitized to it, but we can't negate the fact that it can affect us at some point, or it can affect our colleagues at a different level as well, right? So whether that's experiencing a code blue, right? That's not something that people outside of a healthcare system are normally exposed to. Code bear or code strong, any type of workplace violence, right? Any place where you have to de-escalate a situation or you're just around a lot of tension, right? This can just, slightly alter the rest of your day, right? Any type of medical error you might have done, or you might have been witness to, unexpected severe adverse event of a patient, right? Maybe not even necessarily a death, a patient demise, but a very serious complication that just makes you start, questioning things. It makes you wonder things. Um, like I said, any type of workplace violence, any type of death or illness of a staff member, of a colleague, right? Um, or any type of personal crisis as well, right? A lot of the things that we experience might come from home. It's difficult to separate our home from our work sometimes because we spend a lot of time here, right? So sometimes we might just be bringing some baggage to work from home that we haven't fully settled, right? And again, I think that's why it's important to just be kind to each other, to be able to try to provide that support for each other, because we never know what type of battles that person might be dealing with, right? Um, we could have a colleague that one day comes in with a little bit more of an attitude than usual, or a little bit more negative or pessimistic. Um, Something could have happened in their lives, either recently or a long time ago, or at home, right, that they may be dealing with at the moment, which we don't know what we don't know, right? And sometimes we don't know that we're projecting or that we're transferring this stress onto other people, and especially at work. So this is a quote that I absolutely love. It's a little help, rationally directed and purposefully focused at a strategic time, is more effective than extensive help giving at a period of less emotional accessibility. I I I say this because I think too many people are afraid to help in a time of crisis because they're afraid that they're not qualified, right? They're afraid that they're not a professional, they're not a licensed mental health counselor or a psychologist or a psychiatrist, right? But sometimes, like this quote says, a little bit of help at the right time can provide much more support and much more help than someone deciding to seek professional help a week, a month after the fact, right? Sometimes being in the moment, and not even necessarily even saying the right things. A lot of times there is no right things to say. Sometimes just being there, and just showing that support and that meaningful presence at that right time will provide that comfort and that um, sense of ease or tranquility that the person needs at that moment. And that can go much, much further in supporting that person um, than any type of professional help can do at the wrong time, right? So this is to encourage you guys that you can be there for them. You don't need to have a master's degree or a doctorate degree in this to just be a kind, empathetic person, right? Here's some things that peer support can do in the workplace. Um, Provide understanding and empathy. Peers who have faced similar mental health struggles can offer a level of understanding and empathy that is difficult to find elsewhere, even in professional help, right? A therapist doesn't necessarily know the ins and outs of your job, right? Doesn't necessarily know how much trauma you might be exposed to on a regular day. Maybe not as much as maybe your coworker does, who is in that same shift with you, or who is in a night shift, right? Who understands more than most um, what you might be going through, right? You can also provide validation and normalization. By connecting with others who have gone through similar situations, individuals can feel reassured that what they're going through is valid and normal. I am a huge, huge proponent of group therapy sessions. Why? Not because it makes the therapist job easier, but um, peer support is this wonderful thing where a lot of times people in their times of crisis, what causes this stress is that they feel like they're on an island. They feel like they're the only ones going through this, and no one can possibly understand what they're going through. And sometimes a therapist can build that rapport and validate that, right? But it's gonna go so much further receiving that validation or that normalization by someone who, like I said just a minute ago, right, is in the trenches with you, understands this, right? He can tell you, hey, I go through this all the time as well. Look, these are some of the things that I do to try to help me. But the point is to let that person know, hey, you're not going through this alone. That's not to invalidate what they're going through. It's not to minimize what they're going through. It's just to let them know you're not alone. I experienced this as well. This is a completely normal reaction. Now, what are we going to do to this normal reaction, right? As I was saying, you can share coping strategies, right? You've Some people might have been in this field longer, have experienced these things before, and have kind of learned the hard way how to cope and how to manage through this type of stress, right? So pass down that knowledge, right? Make it easier for the next person, maybe for that brand new nurse who's going through the Horizons program, right? Who hasn't really been exposed to these yet and hasn't really had the need to develop these coping skills, right? You can hand them down through years of experience, right? Peer support groups offer an opportunity to learn and to share coping strategies that have worked for others. Participants can exchange practical tips, techniques, and resources to manage their mental health more effectively. Like I said, not everything works for everyone. Some people get a lot through physical activity, through exercise. Other people might get a little bit more benefits through breathing exercises, through a guided meditation like we did yesterday. Others might feel more comfortable expressing their stress verbally, right? Talking to a peer, talking to a colleague, talking to their family, talking to a professional. Or, like I said before, sometimes you just need to write it down, right? To organize your thoughts in a way where you can just write things down, press that metaphorical release valve, get this out of your system, and then just keep on moving on with your day, right? The thing is you have to try different things to see what works for you. And having someone who has tried these things out, it can significantly help. Um, right here to the right, we see reduced isolation and stigma. Peer support creates a safe and non judgmental space where individuals can openly discuss their struggles without fear of stigma or discrimination. This sense of belonging and acceptance can significantly reduce feelings of isolation and promote a positive sense of self worth. I'm telling you, as an experienced therapist, I think this is 80% of our job, right? It's to create this safe space where the person knows that they're safe, knows that they're not being judged, and they can freely explore their thoughts out loud. As they have that freedom to explore their thoughts out loud, you're going to see that people start arriving to the solutions to their own problems. Um, Therapists are not reinventing the wheel. We're not engaging in rocket science, right? We're just creating that safe space where you will be able to arrive to those solutions yourself, right? And then finally, inspiration and hope. Peer support offers real life examples of resilience and strength, reminding individuals that recovery is possible. It's one thing to hear, this is what you have to do to get better. Trust me, because I read it in a textbook. It's very different than hearing that from one of your peers who has gone through this, who you see can manage and overcome this stress because you see them on a daily basis, right? So it's very different coming from one of your peers. So again, your peer support for one another can go a significantly long way. A lot of times it can do a lot more help than professional help can do. Here's some more things that peer support can do. It can foster social networking, improve quality of life. It can promote wellness, improve coping skills, support acceptance of illness or any type of situation you might be going through, improved compliance or medication adherence, reducing concerns, and increasing satisfaction with health status. These are all things that you can do by supporting your colleagues, right? And I know everyone enters healthcare has a need to help people in some way, and we're so focused on helping our patients that we forget that sometimes we can go a significantly long way by supporting our staff right next to us. So how do we support our peers and colleagues? We just heard some of the benefits of providing this peer support, but how do we do it? Like I said, it's not rocket science. You don't need a master's degree or a doctorate's degree. You just need to be an empathetic person. You just need to be there, right? You just listen carefully. Like I said, being there matters. A lot of times it's not even what you say, it's just sitting there and sharing the pain with them. If For example, right? Spend time with the traumatized person. Offer your assistance and listening ear, even if they haven't asked for help. Now, if they ask for some space, then absolutely, give them that privacy, give them that time to process their thoughts alone. But like I said, just having a meaningful presence, just offering that support can a lot of times go a really long way. Reassure them that they're safe. When we're going through a crisis, we can see things in a very black or white setting, in a very black or white way, where we think there's not a lot of options. We think we're in danger, right? And sometimes we have to remind them that there's a difference between fear and danger, right? Fear is something imaginary. It's something that you're afraid because you don't know, right? If the lights went out in this room, I could be afraid because I don't know what's in the room with me. But that's very different than being in danger. If there was a bear in this room, now I know there is an imminent danger, right? But being afraid is not necessarily the same as being in danger. And sometimes you just want to remind that person that right now in this moment, you're safe, right? That's not to invalidate what they might have experienced. That's not to minimize what they've gone through before. It's to remind them that at this moment, now they're safe. Um, so help them with everyday tasks like cleaning, cooking, caring for the family, minding for the children. Like I said, give them some private time if they need it. Sometimes we just need that space to process things. Um, Sometimes they might react a little bit irritable. Remember those signs and symptoms we talked about at the beginning. Don't take their anger or other negative feelings personally. Um, don't tell them that they're lucky, that it wasn't worse, that everything will be okay, or not to worry. Um, like I said, a lot of times we want to find the right things to say, and sometimes we don't have to say anything at all. Sometimes you just have to sit there with them. And instead, just tell them that you're sorry that such an event happened and that you want to understand and assist them. Sometimes asking them, how can I help you, is going to go a much further way than trying to dance around it and trying to figure it out by yourself. Um, this is just, I wanted to show you real quickly why you don't need to have any type of degree or anything like that to do this. This is an organization that we actually use here for a program that we have called Code Lavender, where um, we train others in this peer support response, right? Um, but basically, this organization, it was developed after 9/11, where they just got a bunch of people who responded to 9/11, who responded to the to the peer support. Um, and they basically just studied them. They just studied these kind, empathetic people and how they provided this peer support. And they basically just broke it down to this um, safer acronym, right? Which is basically just you approach the person and you stabilize them, right? You just make them, like I was saying before, remind them that they're safe now. You acknowledge the situation, you acknowledge what it is that they're telling you that they're experiencing. You facilitate understanding or you normalize what it is that they went through. You validate and then you normalize, and then you provide effective coping skills. That's all you have to do. You stabilize them, you acknowledge what they're going through, you normalize it, you let them know that they're safe now, you give them effective coping skills that maybe you have experienced before. And if there's anything else that's needed after that, then you just refer them to the right help. You send them to a professional, you send them to a psychiatrist, you send them to any other services or resources that the county or the city might have, right? You don't have to do it all on yourself. Provide that initial support, and if anything else is needed, you refer them to the right people. Right? And just I wanted to end quickly. I want to respect everyone's time. This is a short, I believe it's a 3-minute video, so I might go over 1 minute. If you guys have to log off, I completely understand. But it's a very, very nice video that I think will kind of uh, close this in a very nice way. All right. So I say all of that just to say that um, being kind and helping others can go a significantly long way. Um, and you too can make a huge, huge impact on the people standing right next to you. So don't forget that whenever you see someone who might be going through a rough time, um, it just might be expressing some emotions that you're not used to, right? That meaningful presence at the right time can go a really, really long way. With that said, I am a little bit past my time. So if you have to go, please feel free to go. If not, I will be here for any type
Thank
of questions, any thoughts or any concerns.
Thank you, Diego. Beautiful start to the day. I appreciate you.
Awesome. Thank you so much. Thank you for attending, everyone.